So we talked a little bit about your hemophilia and how you were diagnosed. After your diagnosis, treatment options at the time that you were diagnosed back in the 70s was limited. What treatment options were you started on initially?
So, I know that my mom has told me that with my brother, who was born in 71, every bleed was a trip to the hospital. I believe she told me when I was born is right when they started doing the home infusion program. Mm-hmm. So I don't know that even in the first year, if she had to take me to the hospital, she may have, but I don't remember ever having to go to the hospital to get treatment. I remember always having treatment at home. So it was always factor VIII, it was always at home. My dad did it, and then my mom took over, and then I think I learned how to do it. I think I was featured in another magazine learning how to do infusions back in that day.
So you remember getting your infusions at home?
Oh, absolutely. Yeah, I don't remember any other place. I would sit on top of the washer and dryer, and my dad would infuse me in the foot. And then, I don't know, I guess there was more room on your foot because eventually I grew, and it felt like he was always going into the bone after that. Okay, my dad's like, enough, I'm not doing this anymore. So my mom was forced to take over.
Interesting.
Yeah.
And do you remember what age you were when you learned to?
Yeah, 12.
So
maybe 11, maybe 12. Like I said, I remember my doctor at the time at Children's Hospital. Like I said, it was another feature in the magazine, and it's all, look, hemophiliac's doing shots at home, and they had me sitting there with my big fro at the time, learning how to do a shot.
So it's very common for hemophilia patients to learn how to self-infuse. Many patients actually learn at hemophilia camp. They learn as young as 8 years old. Yeah. The average age is about 10 to 12 years of age where they learn to self-infuse, so that's pretty common. Was the treatment effective for you?
The treatment was, I think, as effective as I wanted it to be. I did infusions when I needed to do infusions. Problem was I needed to do infusions a lot. And like I said, I played basketball, I played tennis, I played quite a few sports, so I was always having to bleed somewhere, but I was always stubborn too. So I'm like, oh, maybe it'll go away, it never went away. Maybe it'll go away. So I was not known for doing early infusions. Okay. Again, maybe paying the price, but I did.
So back when Eric was growing up, it was the norm to do what we call on-demand treatment, right. Meaning when you had a bleed, you treated yourself. Now studies have shown that there is benefits to doing regular infusions to prevent bleeds from happening. And so nowadays, prophylaxis or regular infusions of factor VIII right. is common.
Right.
And like I said, it is the standard of care for severe hemophilia patients. Yeah. We've discussed it before, right. And I know you've considered going on prophylaxis, right. But you never actually ever went on full prophylaxis before. What do you think about that? Because many of the patients in your age yeah. group have resisted doing
right.
that.
So, when we talked about it, I remember going back and looking at my logs, and I'm like, I'm going to do this mathematically, right? And, this was long after I stopped being active. So I wasn't having many bleeds. And when I averaged it out, I was only doing a shot a week, as it were. So I really wasn't bleeding that much, or even less than a shot a week. And I just didn't think that doing the prophylaxis at this stage, or when we talked about it, that stage of my life, was really going to do any better, because I wasn't bleeding. I wasn't doing anything. It's hard to bleed when you sit behind a desk all day.
Well, you have children, and
I don't let them jump on me.
But you encourage them to play basketball.
I do.
And you coach them.
I
so
do.
That would be reason at the time to start prophylaxis. We're just trying to improve your outcomes by offering you better medications. And I think my role as a physician is just to let you know what is available for you and to make recommendations on what to do. But again, many patients like yourself, they grew up taking factor as they needed it and did not see the benefits of using regular infusions to prevent their bleeds. But I think that times are changing and people evolve and change.